Hello everyone, I am Dr. Bhavna. Today I am discussing diabetes mellitus. Diabetes mellitus becoming very common in our country. We roughly divide this disease into three types. First one is type 1 or juvenile diabetes. For understanding diabetes, we have to understand the function of one of our abdominal organ, that is pancreas. Pancreas is present in our abdomen. Whenever we take meal, glucose is absorbed in our blood. So for this glucose metabolism, insulin is required. Insulin metabolizes the glucose and provide energy to all the organs. So what happens in type 1 diabetes? The insulin secretion is decreased to very low level or negligible. So the patient has to depend on exogenous insulin injection for lifetime. If the patient does not maintain the sugar levels, then the patient can land up into multiple complications, including complications of eyes, kidneys, heart and everything. So what are the symptoms with which patient comes? Patient complains of weight loss, feeling of exhaustion. Patient always feels thirsty. He goes to urination for multiple times and always feels hungry. The second most commonest type of diabetes is type 2 diabetes, which is occur at later age. It may have some genetic predisposition, but it occurs commonly in the patients who are obese, do not do any type of workout or exercise, and a wrong type of lifestyle. So what happens in this type? There is insulin in ample amount, but it is not sensitive. The patient become insulin resistant. So the insulin does not work and the sugar levels remain high, and that's why the diabetes develop. As a gynecologist, today I am focusing on a third most commonest type of diabetes, that is the gestational diabetes. So first we will discuss a patient who is already diabetic and what complication can she face. So if the patient is already diabetic, she is on some oral drugs or insulin, then she should consult her doctor. She should maintain the sugar levels and her HbA1c levels to a normal level, that is less than 6, and then only she should think of conception. If with high sugar level she conceive, then she may have to face lot of complications like abnormalities in the baby, then miscarriages, in the later gestation, increase weight, increase the water content. The pregnancy may land up in stillbirth, or because of increased weight of the baby, delivery become difficult and there is increased chances of C-section. That is the first type of patient who has already a diabetic patient. So first she should consult a doctor and get the sugar levels done, and close monitoring and diet and exercise, all the things she has to follow. The second commonest type is gestational diabetes. It means for the first time patient comes to know that she has increased sugar levels in the second half of the pregnancy. In that case, she has to do oral glucose tolerance test, and if the test is abnormal, then she should consult to the dietitian. She should follow some exercises and take some diet with low glycemic index and should maintain the sugar level, and if necessary the doctor will prescribe insulin also. So if you maintain the sugar levels, you can avoid all the complications and can have easy and smooth delivery and without complications. So in this disease we need judicious monitoring of the mother and also the baby. In case of mother, she has to monitor her sugar levels, her weight, and also repeated ultrasounds and Doppler studies for the growth of the baby. So regular monitoring and maintaining good lifestyle and diet, she can have a normal healthy pregnancy and a delivery. If you like this video, please share with your friends and family and subscribe our channel.